Hello, everyone. I'm TV, the producer of the Optimove podcast. In today's episode, we talk to Dr. Jeffrey Guild about his motivation behind starting Optimove. He also shares his philosophy around making sure that his physical therapists are empowered to truly help their patients and give them the time and attention they need. Due to some technical issues, the quality of the audio drops off in the second half of the episode. The conversation was so compelling that we decided to include it nonetheless. Let's get into the conversation.
I know you were a personal trainer, strength and conditioning, or something.
First a strength conditioning professional, and then and personal trainer.
Oh, okay.
They tend to go similar.
Okay, close enough.
Close enough.
But you left that to become a physical therapist.
Correct.
Why is that?
I was working with people mostly with physical limitations and the older population compared to a lot of my associates, right? So all sorts of different types of personal trainers. My emphasis was more on correcting movement problems before they became injuries. And I put a lot of study into that when I was working with elite athletes. And so there tends to be a lot of that at the Division I level, where you're basically checking the movement of the young athlete that you're working with, because athletes can be horrible movers, especially if they've had injuries in the past. They're great compensators. And so they learn to move in elaborate ways and perform at a very high level. And that's when the injuries tend to occur. So the idea is to spot the injury problems in advance by checking the athlete at a basic level. How well at a basic level do you move? And then you can figure out what's really going on, identify the problems, fix them before they become injuries, and then you can reduce the risk of injury, and then athletes get to stay in the game longer. So what I did was I applied those concepts and applied it to the general public. I also did my undergraduate thesis on training for leg power in the older population to prevent fall risk. And there's a lot of literature on that. Now that's a component to reducing fall risk, but so I think that basically at the age of 21 is where it piqued my interest about preventing falls in the older population, because we saw the baby boomers were going to come of an age where balance and falls were going to be a significant problem. And where was my role in preventing that problem, especially as someone who was in the strength conditioning world? So did my undergraduate thesis on training for leg power to prevent falls in the older population. So that was at age 21, and then basically went from there. So dedicating my life to empowering people to optimize their movement through their body, right? Because if our body works well, life is a lot easier. If the body isn't working well, life is a lot harder. So that was the focus. So going from that to being a personal trainer who worked mostly with, of course, the general public, but people who are older in the general public and people with physical limitations. So I was already working with people who had strokes or brain injuries or had been in auto accidents, things like that.
How old were you here when you started seeing yourself really focusing on the older community?
About 21 years old.
This was all at the same time?
Yeah, about the same time. And then I started personal training at age 23, 24, 25 is when that was my first career working with the general public before going back to physical therapy school. And why go to physical therapy school? Of course, as a licensed healthcare provider, you're able to do things that a non-licensed fitness professional cannot do. So,
wow. To have found your way at such a young age in such a specific niche is fascinating. Like, you're studying things that I would have never considered until I would probably be that age. Like, man, I wish I could find a specialist on falls. You decided at a young age that this is something that you want to master, and you wrote your thesis on. Yes. So neat. So cool. So clearly it's not something that you just picked up in the last few years, but it's something you've been doing for a while.
Correct. We saw the trends coming.
Yeah.
And what were we going to do as a society? So I think, what was my hand in it? What can I do about it? What can we do about it overall to prevent these problems?
So you mentioned optimum health and conditioning, and that was kind of your focus, and you named your company Optimove, which I imagine is do you tell me
empowering
what the
optimal movement, right?
Yes.
I guess optimism, I think, was another word that was kind of thrown around as my wife and I were brainstorming the name of the business. So Optimum Human Movement, and of course, optimism is a part of that. So even before the actual full vision of what this business would become, I had a general idea of what it would be about. Would it be in physical therapy? Would it be in fitness? I wasn't quite sure yet as the business was actually being structured. But the name fit whatever I was going to do because it fit the overall philosophy, if that makes sense.
It does. It makes complete sense. How did you go from practicing being a physical therapist to then deciding to open up your own business? What was the motivation there?
Recognizing that, of course, with any business owner, entrepreneur, this can be done better. Right. There's often a sense of like this can be done better. And, the roadblocks that you would hit trying to change things within a system, it's easier to change. It's easier to start something brand new than it is to change something that's already established. And when you're in a career, sometimes you learn that the hard way. And so then do you want to start up your own thing and take that step? Or what do you do from there once you realize that of all the walls that you keep hitting when you're trying to change something and it doesn't want to change?
What type of walls were you hitting?
Oh, I mean, large healthcare systems don't want to be changed. They can change through example. They can change through market forces. They can, of course, government can come in and change things for better, for worse, or whatever it might be. But I think the most powerful, or what we have most control over, are market forces and then examples.
Right. That makes perfect sense, actually. If a large institution sees some group having massive success with a new model, they will end up replicating it.
Absolutely. Or you see success, like if you see other business owners and like, wait a minute, this can be done.
Yeah.
You see someone like you doing what you want to do, but didn't think was possible. Then that empowers you to think, well, maybe we can do this. Or let's say you have a business that people don't know about. And then, wait a minute, that's already being done. I can work for a company like that.
Yes.
I can actually practice medicine in this style, in this fashion, the way that I want to, the reason I went to physical therapy school, or I went into medicine. This is the reason I became a physician or a physician assistant, whatever. This is why I went into medicine. And can I work in an environment that promotes that? Which is really almost why most healthcare providers go into healthcare. It's to serve their patients and serve their clients, to help people feel better. It's not to become a cog in a wheel. It's not to become a bureaucrat. It's not to just check boxes and fill out red tape, which is what healthcare in the traditional model has become. And so a lot of healthcare providers are trying to find ways out from that. That's often the biggest pain point for a lot of healthcare providers. How do we actually do what we want to be able to do this career that we dedicated so much time and energy and money and everything else to do? And now we find ourselves just being shoved into a work environment where we're just considered basically a bureaucrat, a cog in the wheel.
Right.
And we're kind of stuck.
Yeah, it's unfortunate and sad to hear. So I have to ask you then what is your approach with your company, and how do you go about doing the work and encouraging your therapist to be able to help the people?
So what we do is, it's of course one-on-one care with all of our clients. That's one of the big pain points for physical therapists right now is, especially for neurological physical therapists if you're doing a lot of balance training and, helping someone walk, you need to be able to provide that one-on-one care and treatment. And when you're not able to do that as much as you would like, or the system is rubbing against that because you're having to fulfill a quote unquote productivity standard.
Right.
It's not gratifying for you or the patient / client. And again, you find yourself stuck because you're not able to practice medicine the way that you want to do it. You're not implementing your skills, your training in the best way possible to help the person that you're working with. So what we do is one-on-one care, one-on-one treatment, full hour, one-on-one every time. That's basically the standard. That's the norm. That's not the exception. And combined with that, a whole team approach where we work with our clients and combining multiple brains together.
That's different.
Yes. And that way we can get several good, very intelligent minds on one case, if that makes sense.
It does.
So that way the clients are utilizing a combination of healthcare providers that are in collaboration with each other and communicating directly on a regular basis and feeding ideas into each other and solving problems. And so that way they're able to get the most out of what the whole team has to offer.
That's fantastic. Wow. I can't help but imagine being a physical therapist in a normal organization and feeling like you are part of the problem and you're trying your best. You didn't get into it for that reason, but you can't spend the time with that individual and they know it. They're upset with the physical therapist, but if they had control of it, they would totally not do it that way.
Right.
And that has to be incredibly frustrating for the person practicing who went into training, took all that investment on spend all that money in education only to find themselves stuck in a rut and in a rat race, I suppose. Right.
You find yourself in a situation where not only you have that, where it basically your productivity is based on, how much can you bill? And that's true for physical therapists. It's true for physicians, true for the vast majority of healthcare providers. How many units can we bill? And that's what becomes important, and which of course is not the reason why anybody went into healthcare. And so you find yourself, of course, dealing with that issue, but also every step of the way, you're being demanded of higher productivity, but yet the systems are oftentimes not being put in place to set you up for success to do that, right? So it's oftentimes the company is not taking into consideration, how do we streamline things and help you become more productive? How do we make the documentation easier? How do we make simple things like the internet speed, having enough computers, just simple things like that. So what we do is we empower our therapists to be able to streamline through everything as much as possible and take that into consideration. How can we help them become more efficient? Of course, there's documentation that has to be done. Of course, there's some bureaucratic things. There's some of that has to happen. So how do we streamline that using technology, using systems, using people to be able to streamline all that to make things far more simple, far faster. And we put a lot of focus into that because that's important. It also improves morale of the team, right. It improves efficiency. And of course, communication gets through a lot faster. And so then we can optimize both everything for the team and for our clients.
Everything just flows better.
Everything flows better.
And in larger corporations, it tends to be that they don't improve on technology fast enough because it's probably going to cost way too much and it's not worth the time. So you're going to have to deal with this old technology, these old systems. It's just the way we've always done it.
One of the biggest challenges in healthcare is mediocrity. And it's the mediocrity of the system, which then leads into the people, and it goes downhill from there. Yeah. Right. So it's a problem of the mediocrity keeps feeding in itself, and it's representative in the EMR system, the documentation, the systems that are in place, and then that transfers over to how healthcare providers are taking care of their patients.
Everything flows downstream, and the client, the end consumer, gets a service and a product that is less than adequate, considering how much they're paying, and how much they're hurting. And that's probably the worst of it all.
Right. The patient / client is the one who suffers the most at the end of that downward chain.
Yes.
In the healthcare system. And so everybody ends up getting hurt because of the mediocrity, but fed from the top down.
Right. How are you different when it comes to actually bringing people on, nurturing their talent, and giving them the support that they need for your physical therapist?
Right. So the people that we bring on, for one, we make sure that they're a great fit for both our clients and for the team. Can someone who's going to come and work with us, do they just genuinely love working with the type of clients that we have? If their main focus is they love working with elite athletes, that may not be the best fit for us at this time. Do they love people working with people who are 70 to 95? Do they love working with people who have neurological disorders, or who struggle with chronic pain and things like that? Do they have the right temperament? And also, do they have the good foundation of communication on the front end? Because communication is a large part of it. A large challenge in healthcare is the lack of communication or effective communication from the office to the patient or client. And so that's another thing we focus on is the communication, both at the, say, quote unquote, front desk to our clients, but also the healthcare providers who provide the service, provide the outcome. How are they communicating with the clients on a regular basis that's exceptional every single time, every single day, providing a wow level of service, brightening people's day? That's what it's really all about. That our clients enjoy being around our healthcare providers, our team in general. They love talking to the people who are giving them a call to schedule the appointment and brightening their day.
That communication from the first point of contact is, I found, incredibly important. Because in my background, I used to be in the grocery business.
Right.
And from the moment they walk in, everyone's kind of touching them and speaking to them. And if they have some person, especially at the beginning, that does not introduce themselves well or do not at least come off with good positive energy, the rest of the experience throughout the process as they walk through the store and eventually get to the front end will be dictated by that first person. And communication, you're talking to people that are hurting. You're talking to people that are needing your help right now. If that's not at the forefront, then it's all going to once again be downhill from there.
The first point of contact, right? Then what ends up happening is back to the grocery store, the person just walks out the door and goes somewhere else, which maybe they go to a competitor, but I would say worse, they just go home and don't get the thing that they were looking for. And it's even worse in healthcare, because then you have someone who is decided to make a decision to solve a problem that probably has been going on for a long time, or they're in an urgent need for help and they need the help, and they make that call. That first level of communication isn't there. They don't go elsewhere. In worst case, they do nothing. And then they don't solve the problem. And then what happens to them? And for our clients, doing nothing can result in hospitalizations, going to the nursing home, death at times. Let's think about a doctor, right? If the front desk person in a doctor's office is not fielding calls correctly or not communicating with people, and the patients or clients cannot get through, then some serious consequences can happen. In physical therapy, while oftentimes isn't always as life-threatening, it can be, or the person, a fall can be life-threatening. Right.
What else do you provide for your physical therapist in terms of their growth?
Sure. So we put a lot of emphasis on mentoring and training, both clinically and as far as conversation or communication to the clients. So how do we empower our team to be able to communicate the most effectively with each individual client every single time, and give them the support to be able to do that? Both the training when they come on and work with our team, the way that we the type of people that we hire to begin with, making sure that they have that foundation. Have they worked in customer service before? Have they waited tables? Have they worked at Starbucks? Have they, done those sorts of things?
Those are integral skills.
Those are so important.
Yeah, like they transfer over into every aspect, including this type of work.
Absolutely.
Yeah.
And, just dealing with difficult situations in as far as human relations, right? So those are all important skills that we want our team to have. And so then we put those people as team members, and then empower them further, work on that communication, and every single time with the clients. And then for this type of client, how do we need to be able to communicate? Because not the communication is not the same across the board for every single person. You're going to have to communicate differently based on what's going on at the time, based on what is the client challenged with, how old is the client, or a whole host of things that will determine how do I need to communicate with this client today. And of course, it can change day to day. I started seeing that when I was personal training. You might be
mood alters.
Yeah, you'd have one client where you'd have a 38-year-old trying to get big and lose weight, and they're excited about all these things, and then you have another person come in and they're absolutely in tears because their kid is getting picked on at school, and then you're spending the entire time.
Oh, wow.
And it becomes a psychological session, and you have to pivot.
Right. He still has a support.
Right. So personal training actually was a very good way to develop those skills as I went into healthcare, because you have to be able to pivot on a dime, because the next person that you see is going to be in a very different situation than the person you just worked with. You have to be able to pivot on a dime and meet the person where they're at.
Yeah, you say that often, and it makes perfect sense.
Yep. And coaching our team to do that as well.
Yes. And I was supposed to even encouraging them that's okay, that the system they came from, the expectations that were there in terms of filling hours or billing people according to just the session, like take time to actually get to know the individual.
Absolutely. And some of our PTs have been surprised when I'll tell them, no, go ahead and run over on time. If you're given this much time, but the evaluation goes longer, go ahead.
Okay.
It's okay.
Wow, that's different.
Because we've got to collect all that great information at the very beginning. When we do the full formal evaluation, we need to be able to spend the time, gather the information, make sure that the client is safe and secure, make sure that we have all the information that we can before we talk about a full plan. We need to have all the information that we can get. So if you need more time, take more time, and we'll empower you to do that. And our team will support that, and we'll find a way to work around that so you can get everything done that you need. If something complicated is happening in a scenario and you need to handle up on it, you got a team to support you, and we'll interact with your next client, make sure that they know what's going on. And so you have a whole team backing you up. Or does another therapist need to go see your next client, right? So, because our clients can be complex and things happen. How do we empower the healthcare provider to be the best version of themselves? Mm-hmm. Right. Meeting the healthcare provider where they're at. Right. They're going to come in with a certain mindset. They'll have worked in the healthcare system for a time. They're going to come in with a certain mindset. We have to recognize that. That's where the coaching comes into play. That's where the team support comes into play. That's where we have to probably multiple times over say, no, it's okay. Right. Here, take more time. Yes. Here, no, like you can just sit and talk with the client. Yes. You don't need to be doing quote unquote billing activities constantly. Build the rapport.
Which is essential.
Right.
If you're going to get them to follow through on some of this stuff, is that rapport, that connection. And it takes time. You can't rush rapport. You can't rush connection with the patient, because they're just going to sense that. So they're not going to give you their all.
Right.
I imagine.
Right. I can't tell you how many times, you'll be working with a client and they're just telling you a lot of stuff. They're pouring their emotions out, because what we work with can be difficult at times, or just sometimes people need to get stuff off their chest, right? And you're not going to stop when the hour's up.
Wow.
You sit and you listen. You take that in. One, because it's the right thing to do. Two, it empowers the person who is opening up, and it's going to help them. It's going to help you identify, how do we help this person even more? So it's okay to go over. I had a recent experience where someone went to a counselor or psychologist or whatever, and it was exactly what you expect from the movies, which was, okay, time's up. Right? Now, I don't know if that's normal throughout counseling or psychology. It's just an example.
Like, okay, the word time's up. Like, I was in the middle of something.
Right. And it's that way a lot in healthcare, because you have to be on that rigid schedule, rigid clock. Now, in physical therapy, it's not, okay, time's up, because it's not one-on-one. Even worse, you might be circling, working with, 3-4 people at the same time. And so you're just trying to find that rhythm of, how can I get as many billable units in as possible. And then, of course, the insurance companies then add in their own ways of preventing the healthcare providers from working with multiple people at the same time, which means that you can only work with a certain number of people at a time, and then along with reduced reimbursement rates. And then you basically have an individual practice that can no longer work in the healthcare system as it has been for the past 10, 20 years. They're either going to have to sell it to a larger healthcare company, or change their model, or something. They can't keep operating in the traditional model. So it's just this back and forth cycle all the time. And that's what's so frustrating for healthcare providers, because healthcare providers are not bureaucrats, but yet, from the top down, the system is expecting healthcare providers to operate and think like bureaucrats. We did not become healthcare providers to be bureaucrats. We became healthcare providers to help people.
It's something in your nature,
right,
to want to help.
Right.
Something at an early age for many of you.
Right.
Collection, like, this is what I want to do.
Right.
And to have to then work in a situation that is anything but that is creating this animosity between patient, employer, therapist, doctor.
Right.
It has to be overwhelming.
Right. Now, sometimes some healthcare providers just grow to accept it, and that happens, and that's an unfortunate scenario. Not their fault. From the top down, the system is working against both the healthcare providers and the end consumer, the patient or client. I had a doctor, we had a client one time who just was so frustrated in the traditional model, and he asked his doctor, does it have to be this way, right? Like, why am I only able to see you for this amount of time, and it's so difficult to communicate with your office, and all of these problems, frustrations that he was having? And the doctor just said, well, that's just the way it is.
My sister, who's taking care of my parents, I've told you about numerous times.
Right.
She told me she was having trouble getting a hold of, and you just reminded me. Because why is it this way? Even just answering the phone. My sister ended up showing up at the office because she was trying for several weeks to book an appointment for my mom. I was going to say her mother. My mom, our mom.
Right.
And she finally just showed up, and they said, "Oh, thank you for coming in." And she's like, "Well, you didn't give me a choice. You're not answering your phone. Mm-hmm. What's up with that? Like, how is that even a thing in this modern era where you should be taking care of people? We're paying you. Like, it's like you're being incentivized, yet I guess because of who knows what, it makes it virtually impossible."
Right.
It's insane to me.
It is. It is.
It's mind-boggling.
You want to pull your hair out, right? Because it's so frustrating. We had a client who was, oh gosh, they were probably about 85 years old. We were working with the husband and his wife, pretty good, but she's not 25 anymore, right? So, she's 85 years old, and she has to get a hold of the doctor's office. She, on 2 occasions, just like what you talked about, drives to the doctor's office, walks in the office, because she can't get a hold of anybody through the phone.
It's uncalled for.
Right.
It's unprofessional.
Right.
If I call McDonald's, I want them to answer this stinking phone. Why can't I expect that of anybody that's taking care of me in the medical field? It's a simple process now. Just make that connection, make that phone call, pick up the phone, or whatever you have to do in your systems to ensure that someone is getting taken care of. You said it earlier. It could be a life or death situation.
Right.
You just don't know for that individual.
And it was, by the way, in that situation, on a couple of a time, they could have gone to urgent care, because there are those scenarios when if you can't get a hold of your doctor, okay, well, I guess urgent care, the ER is the next step. But it's how many urgent care or ER visits can you prevent if you are able to get a hold of the doctor, if you can get a physical therapist to get out there quite quickly and prevent decline, right? Because people can be admitted to the hospital just because they're physically declining. They're becoming less independent and mobile in their home. You have no choice but for them to go to the hospital, and then you just push the reset button. But if you can get a physical therapist or an occupational therapist out there and prevent that decline or do some problem solving, again, that's what we're there to do. And that's why the mobile service, so we can get out there to people and prevent those issues.
Fantastic. As a physical therapist, what can a person that's interested in working for you or being employed by you, what can they expect from the company? What are your values, and what do you see yourself doing?
Absolutely. Of course, empowering them to, what do they want to do? Let's say clinically, what do they want to specialize in? What do they want to become very good at? And empowering them to be able to do that. Are they interested in a certain specialty of some type? Now, most of our physical therapists are empowered to be vestibular specialists, because that's one of our main specialties. So dizziness and balance and falls and vertigo, we need to be able to service that very well consistently across the entire team, unless if we bring on a different specialist, right, who's dedicated to say orthopedics or something else, right? So empowering our team members to be able to be the best clinician they can be, and at the same time coaching them so that they can provide the best service as far as communication, how we interact in people's homes, brightening people's day on a regular basis. A lot of times what prevents someone from continuing on with their treatment or their care is not the fact that you didn't provide the outcome. It's the fact that the healthcare provider or the front desk or the system, whatever it might be, didn't communicate effectively. It's the logistical things that fell through the cracks, and we're not perfect. We never will be, and we will make mistakes, but it's always obsessing over making sure that those are the things that don't fall through the cracks. So streamlining that and empowering our therapists to be able to make sure that those logistical things are well supported, so that they can empower their clients to get the outcome that they want. And of course, providing the support to our clinicians on a regular basis, both in education, communication about all of our clients. So being in regular communication, having meetings about what's going on with this person, what's going on with this person, how do we empower them to be able to get to doing this, what medically is going on in this situation, and so that way we're staying up to date. So it's communication both with our clients, but also with our team members as well. Our team are empowered to be coaches.
Yeah, there it is.
Right.
Yes.
And we've even done mentoring on that, and even the question came up one time with one of our physical therapists, like, how do I be a coach? And so then we are doing coaching with our physical therapists on how to be a coach for the clients, because that's what the client needed. Because it can be, in physical therapy, a longer haul, right? It's not always a quick fix, and in physical therapy often it's not. So this is going to be a long haul, and this is going to be a lot of work, and can be challenging, and we're going to have to do some problem solving. It might be 3 steps forward, 1 step back. That can be hard to do if you're the client. So then the client better really enjoy being around the person that's coaching them through that, empowering them, problem solving through the bumps in the road along the way, and also the physical therapist gets to enjoy being a coach and be empowered to do that, and to enjoy that interaction with the client. And of course the client needs to enjoy being around their coach. And yes, there is a certain level of like, yeah, I'm doing this for coach. We've all been there, right?
Yeah.
What you do it for yourself, but what really gets you to make accountability, right? What gets you to really take that action or take that extra step or really push above and beyond? It helps to have a coach that you're thinking about, that you want to make happy, or you don't want to be let down, or whatever. So coaching is a big part of what we do as well. And it's whatever empowers people to be able to make the right decisions about their health, and to be able to take the right steps of action and the behavior that we do, myself included. None of us are exempt from it. How do we take the action needed to get the end result that we want, and enjoy it along the way?
Yeah, I think it becomes a fruitful adventure when you both enjoy each other's company.
Right. Right.
There's going to be some laughs, stories are going to be told, work is going to be done, improvements are going to be made, and they're not going to want to let coach down.
Absolutely. Our team members have to love our clients as well.
Yeah.
And if they don't, it's very apparent. It's going to show up in every aspect of what they do. And but we make sure that on the front end, before we bring them on with the team, they gotta love working with the type of clients that we work with.
Awesome.
Hello, everybody. This is TV again, the producer of the podcast. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thank you for listening, and we'll catch you in the next episode.